Go ahead, Bill.
Okay, sure. Yeah, so we'll move on. Creating a comfortable surgical experience for both the surgeon and patient. I think we live in a world now where expectations of patients are rising faster and faster. It's really hard to stay ahead of the game. I look back at, my dad was an ophthalmologist, and his generation kind of had this phrase, no pain, no gain. And it was almost expected if you're going to go through a surgical experience, there's going to be a little bit of discomfort, but you can have this gain at the other end. I think the current generation, this young crowd that is getting LASIK and SMILE and corneal refractive surgery, their basic philosophy is no pain, no pain. They do not want to have pain. And if it's our job as providers to try to meet that expectation, we live in a world of a lot of virtual reality and things like that, and you see them when they get into the surgical suite, it is like game time. Reality comes quick to them, and those patients really are expecting a great surgical experience. And so anytime we can take a step forward in that regard, I think is we're moving our field in a better direction. So thank you, Zeiss, for creating a platform that truly does make a better surgical experience for patients. A few things, Sunny discussed it as far as the speed of creation, that lenticle creation, less than 10 seconds. So we've chopped 20 seconds off lenticle dissection, or creation, and then also dissection. It's that much easier. We at our center work with fellows, Sud Koshik's here in the audience, and my fellows currently learn SMILE and learn LASIK, and it's kind of interesting. They tend to, traditionally actually learn SMILE quicker than they learn LASIK in our practice because they've started fresh. These are green surgeons, first refractive surgeries, and often we're doing every patient that comes in that fits the SMILE parameters, we're doing SMILE on, and so they're often getting more SMILE experience than LASIK. And but without a doubt, there is a learning curve, and a lot of it is the dissection. And I think that's what a lot of surgeons have hesitated. If you're thinking about doing SMILE, you're like, gosh, I don't want to go through a learning curve. It's not easy, but having an ability to make that dissection, like Sunny and Audrey and John has discussed, if you can just go in and almost virtually just grab that lenticle and not have to worry about a challenging dissection, I think that makes your job easier. And I'm looking forward to being a teacher and a mentor through this on a new platform to make it that much of an easier teaching and learning curve. Here's going through a dissection here. You can see that's first an anterior tunnel. Now I'm going posterior. This is the posterior dissection. So I first went anterior tunnel, posterior tunnel. Now I'm going back in and dissecting anterior. I'm sorry, this is, I've actually already fully dissected posterior. Now I just did the anterior 2 swipes. It's going so quick, I can't, I kind of got myself lost here. Again, oh, actually it looks like that one. Yeah, okay, now I'm back anterior. And you can see more or less a very smooth and easy dissection. This is usually the most anxiety-provoking step. I think my first SMILE case, I think it took me 10 minutes to do the dissection. And I thought, man, when I saw videos, I thought to myself, like, these videos look a lot easier than the ones when I did it. And now we truly have a platform that does make that step truly seamless. As John initiated a study to allow us our first surgical experience, and we looked at central line satisfaction was very good. Ease of lenticle dissection 1 to 5, 5 being the hardest. We had an average score across multiple surgeons at 1.4, really easy dissections. Overall opinion of the case ranging from 1 to 3, and again, very happy from a surgical perspective. This is my team. We had a very challenging, we wanted to train 4 surgeons on SMILE in 2 days. And the very first, Kathy G is one of our ex-fellows. There's Sean McBoffna, my partner, Sud Koshik, Dawn from Zeiss. And we trained 4 surgeons in 2 days. And the very first case was a -1 by Kathy G. I think it even gave Zeiss pause. They're like, okay, do you really want to do a -1 your first case on the VisionMax 800? Most surgeons don't even attempt it even after years of experience, and this is the first time on that laser platform, and that case did great. The patient was 2020 day 1. So even on the really high pressure situations, the lenticles are so easy to remove. She did great. Studies had kind of confirmed what we're seeing, that better, faster surgical experience is better patient experience. And like I said, we're always constantly trying to meet that patient expectation. The other thing I think is, as far as surgical experience, has anybody driven a modern car, Tesla? How many people have a Rivian or Tesla electric vehicle? Once you drive that vehicle and then you go back to kind of a non-modern vehicle like that, you're thinking, where's my touch screens? Where's my views? Where's my camera views? Where's my automation? You get addicted to that kind of experience, and I feel like this is the first modern laser that has some of those feature comforts that we're used to in the modern day tech world. During the docking, there's multiple camera views. It's kind of like when you're backing up in a car. You used to have to look in the rear view, and now you have views and multiple views to show you where you are. Same thing with the Zeiss VisionMax. So it truly does bring this kind of modern graphic user interface that makes that surgeon comfortable throughout the case.